This is a young Tourette's patient with OCD whose tics began at 9 years old. He gives a history of head bobbing, lip licking, vocal tics, throat clearing, shoulder muscles twitching, a feeling like he wants to explode, snorting, back arching, etc. This is the cephalometric x-ray for this young man, and you can tell immediately by looking at his soft tissue outline with his lower lip horizontal that he is overclosed. In other words, he needs an increase in vertical dimension. Also note that the mandibular borders of the left and right sides of the mandible are not parallel and superimposed over each other. One is higher than the other. That is indicative of shortening of the condyle up here in the glenoid fossa. This boy has a decent airway going for him, and he has no suboccipital compressed tissues. The first cervical vertebrae is supposed to be on a 45-degree angle, which it is. This is this man's left tomographic TMJ x-rays. This is initial contact, and this is wide open. And we make sure that the condyle translates out of the fossa, past the articular eminence, and is separated from it by at least 2 to 2.5 millimeters. We do not want the condyle touching the eminence. These are the right tomographic x-rays of this boy. This is centric occlusion here, and this is wide open. Again, we want to check the translation of the condyle to make sure it travels past the eminence and is separated from it by 2 to 2.5 millimeters. This is this young man's submental vertex x-ray, and it shows the mandible, which is outlined here, is not located in the center of his cranial base, but is displaced off to your right. You can see the difference between how much the ramus of the mandible is inset from the lateral surface of the skull on his right side and how it is overlapping the lateral surface of his skull on this side. The whole mandible is displaced to your right. What's your worst tic that you have?
My worst tic is probably right now it's probably maybe the lip licking. Yeah, lip licking tic. What it would make me do is make me move my lip up and rub the all the saliva on it, and then it gets dry. And then when it could last about maybe about a week, depending how much it
Show us how you do it. Okay. And you do that all the time? Or most of the time?
Mostly, once in a while it does it.
Okay. And you have a head bobbing tic?
Yeah, the head bobbing tic makes me during the 4th grade I didn't know that I had Tourette's when I had my friend over. We were in the backyard. I was by the fort, and I kept bobbing my head, and I was like, I kept bobbing my head like this, and it eventually started to kind of hurt a little. And I was like, he asked me, "What's wrong? What's wrong?" And I said, I don't know. I didn't know, and then eventually we found out that I had Tourette's syndrome.
Okay. What other tics do you
have? Sometimes I have a certain kind of tic that like if I'm walking through maybe the mall or a grocery store, kind of wants me go like this and bob back.
Oh, okay. Do you have any shoulder shrugging tics or any other walking tics? Or?
I used to have a tic that would have me twirl around in circles in Target.
Oh, Target store.
Yeah, it will have me. It was during also it was during the 5th grade.
Okay.
That would make me like just twirl around.
Twirl around. Okay. Okay. Well, today we took all kinds of impressions and X-rays on you to do our fabrication of your mouthpiece, which we're going to have ready for you in 2 days. We'll send it out to the laboratory tonight, and it'll be made tomorrow, and then we'll have it back the next day for you. Okay? Do you have any questions you want to ask?
No, not right now.
Okay, good. Okay. Tell the viewing audience what your hopes are for this treatment.
I hope that this treatment can help me. What I really want to do is go on classes with my friends. I hope this treatment will decrease the level of my tics. I hope that it will really put my tics down, and that I could learn a little bit more better, because the tics, they can really get in the way of your learning skills. So I wish I could so I hope that I could learn better. Go around in public more, like I won't do much as tics as a lot. And I hope that this mouthpiece would succeed, and that I would be just like a normal person.
How are your grades in school?
My grades are good, really good.
Okay. Do you have to work extra hard to get good grades?
Yeah.
Yeah.
A little bit, yeah.
Is reading hard for you?
Yeah, reading can be hard.
Yeah. Okay.
It's hard for me.
Okay. Let's leave it there, and we'll see you again when we put the appliance in for you.
Yeah.
One of the clinical signs that this patient was overclosed, or that his lower jaw was too close to his upper jaw, came on the lateral skull x-ray, which you see here. When the teeth are closed, the lower lip is supposed to be vertical, and as you can see on this patient's x-ray, his lower lip is horizontal. You can see this vast curve underneath the lower lip here. This should not be here. Whenever you see a patient's soft tissue appearing thusly on an x-ray, you can know that the patient is overclosed. Another way of saying this is that his chin is too close to his nose, and this dimension needs to be increased, which is one of the functions of the appliance which he will wear. Another clinical indication is that his overbite, or the amount of vertical overlap of his upper teeth overlapping vertically the lower teeth, is too great. It's 60%, which you will see later on in a frontal view of his teeth. It should be no more than 20% at the maximum. These are both indicators that he is overclosed and needs to have the distance between his upper nose and lower jaws increased. This young man's intraoral mouthpiece today. The question always arises, how thick do we make it, how tall do we make it, how high do we make it? And one way to do it is by putting in popsicle sticks or tongue blades and varying the height up and down to see what makes the tics go away. We have done this on him and have determined that a height of 3 tongue blades drastically stops his tics. And so we are going to start with a height of 3 tongue blades initially for his mouthpiece. What we are going to do is mix up some acrylic, put it on this mouthpiece, and then have him close down on the soft acrylic till he reaches a height of 3 tongue blades. Open. You ready?
Mm-hmm.
I am loading the freshly mixed acrylic onto the mouthpiece. like so. And I'm going to put it in the patient's mouth, open. Making sure the appliance is completely seated on his lower teeth. And then I'm going to have him close down, bite, until he closes down on the 3 tongue blades. Then open. I'm going to have him open. And I'm going to take out the appliance. And then I'm going to put it in the cooker while it hardens up. And I'm going to trim off all the excess acrylic. Okay, we have adjusted the patient's appliance, open, and we are delivering it right now. And fitting it to his bottom teeth. Bite. Okay. Okay, now how's that feel? Yeah, hitting even? Yeah, okay. Good. Okay, look in the camera. Look in the camera. Okay. Now you're coming back this afternoon, right?
Correct.
Yeah. At what time?
I think like 1:45.
Oh, okay, good. That'll give him about 3 hours with it, then we'll do the final adjustment. Then you leave it. You feel more relaxed or anything like that? Yeah, good. Okay.
You could notice a difference.
Say again?
You could notice a difference.
Mouthpiece has really helped. Really helped with this. It has really improved that I'm not as taking as much. Like I would still have a few ticks once in a while, but over time it will get better. And during the 3 hours, I was like hardly ticking, and it really helped. It really helped. It really did. I'm talking fun with it, eating fine with it. It's not hard at all. It's really easy to eat and talk with it.
Ken has had the mouthpiece for 3 hours now. And he's just come back here before he leaves town and for a quick checkup, and he seems to be progressing quite well. Okay, this young man returns after 4 months because he lives so far away. He's been under the care of another TMJ specialist out in his local area, and we rebuilt his splint today. Take a look and bite. You can see how tall we made it here. It's about 6 or 7 millimeters high. Don't be afraid to make them this thick. We made it this thick to compensate for the long intervals at which we see him for the wear and tear. And he's doing quite well. You can see he's lost all that discoloration around his lips, and his head movements have diminished greatly. In fact, they've ceased as he sits here in the chair, and this boy is responding very well, as he should.
It actually helped me really well when I just came in here. I was taking a lot more, and then when this got built up, I just really relaxed a lot more.
Tell him why you're in Washington.
Part of the reason why I'm in Washington is because I got elected for a Tourette Ambassador program. I got elected for that, so I'm going to have 2 days of training over at the state capitol, so that's going to be a really fun time.
Okay. And you're going to be meeting members of Congress, right?
Yeah.
Good. Well, we've got a budding politician here. Why don't we have his mother say something? Why don't you look at the camera? Okay.
Hi, I am Kenny's mom. I'm Carla Richards. I was elected Mrs. Washington last year, and my platform was embracing the special needs child. And part of that, of course, is advocating for my own son who has Tourette's, which is why I met Dr. Stack after doing research and found out an alternative treatment for Tourette's. So we came here last November, and before we met Dr. Stack, my son, one of his large motor tics was doing circles down the aisles of Target, for instance, or he would jump back like he had a string pulling on his back, so it'd take a long time to shop at the grocery store. But he no longer has those large motor tics, so that has been a huge blessing. The challenge, of course, is just being able to keep up with follow-up appointments, and not everybody on the West Coast knows of Dr. Stack's procedure, so we are trying to educate them as well. So it just so happens we're killing two birds with one stone. My son got elected to represent the state of Washington at the National Tourette Syndrome Association Youth Ambassador Leadership Program. And my son and I, we also started a support group together, so he reaches out to the children and I reach out to the parents. Although he reaches out to the parents too and gives them encouragement. And so we're hoping after this training we'd like to go back and visit schools and educate parents, teachers, and students on Tourette's, how to advocate and empathy skills, and of course how to implement programs as far as a teacher's perspective, and of course to educate people about this alternative treatment as well. So we are very encouraged, and we're just taking it one day at a time, but so far everything's looking good. So just seeing him right now, it's a relief that I see him having some relief from getting an upgrade to his the level of his retainers, so I'm excited